All right, today's topic is on ankle sprains. So most normal people at one point in their life will suffer an ankle sprain. They often happen in sports, but can also happen at work or at home when you step in an uneven surface on the grass or trip down the stairs. And so it's important that you take some steps when you sprain your ankle to make sure you heal as quickly as possible and to make sure that it doesn't become a chronic pain that lingers for a long time. There's things you can do to avoid that from happening. So if you do suffer an ankle sprain, the first thing you need to do is make sure it's not fractured. And sometimes that can be a little bit difficult to distinguish when it's swollen and bruised. Ankle sprains generally will improve significantly each day after it happens, whereas a bone fracture will probably continue to hurt pretty bad for that first week when you step on it. So make sure you get that figured out before you proceed with therapy for an ankle sprain. So when people sprain their ankle, almost all ankle sprains occur like this, where you roll your foot inward. It's called an inversion sprain. And what happens is there's some ligaments here on the side of your ankle and your foot that prevent you from going too far this way. And when you sprain it, then you've overstretched or maybe even torn those ligaments. And so if you recently suffered an ankle sprain, I'm going to give you a few basic ideas of what you can do to expedite that recovery process. So the first couple days, not surprisingly, you need to ice it and rest it and elevate it. And when people elevate it, sometimes they just prop their foot up on a recliner chair. And I would actually encourage you to lift your foot up a lot higher than that. You want your foot to be higher than your heart. And so the way I like to do it is to climb on your bed and prop your foot up on the wall if your bed is on the wall, or you can just lay on the floor next to the wall. And you want to keep it moving, and so while your foot's way up in the air, write the ABCs with your big toe. So make big movements, as big as you can go, and go through the entire alphabet. And if you go through the entire alphabet with your big toe, it will really help you move the ankle in all different motions, and that will help to keep it moving, which is important even soon after the ankle sprain. And doing it with your foot up in the air will help with the swelling as well. So do that and ice it for the first few days. And then hopefully within a week, if it's not a terrible bad ankle sprain, you can start to do some really gentle resistance exercises. And so what I would recommend is getting a rubber band. So these can be bought online or at the store. They're very inexpensive. And they're good for ankle sprains because they can give you just a little bit of resistance. And so I'm going to show you the 4-way ankle motion. So basically we're going to pump your ankle forward, backward, left, and right. And those are important muscles to keep moving and keep strong. So forward is pretty simple. It's just like you're pushing on the gas pedal. And the resistance band is good because it kind of helps you stretch your toes upward, which is often very stiff after an ankle sprain. So you can kind of pause between each one. So that's upward. That's a resisted plantar flexion. And then the other one is the exact opposite, where you're going downward. So I'm just going to lock this band on the floor with a dumbbell, and you can do that at home by wrapping it around like a leg of your chair or leg of a table or a couch leg, and you're just pulling straight up on that like so. And this works the muscles in the front of your shin, and also the stretch downward can pull your toe downward. So you want to go nice and slow and do about 20 of those. And then the next two exercises, we're going to go left and right. So the first one, we're going to go ankle inversion. So I got my heel planted on the floor, and I'm just going to rotate my ankle inward. So that works the muscles on the inside here and will help stabilize the ankle. And the last one, which you've probably guessed, is the exact opposite, where you're going to go outward. Now, if you've had an ankle sprain, this one's probably going to be the most painful of them all. So you want them, it shouldn't be too painful. So you want to go kind of light resistance. And again, you're just keeping your heel planted and you're moving your foot outward like this. Okay, another good activity after the swelling kind of goes down is to give your ankle a nice massage on the side. So you've sprained these ankles or these ligaments on the side. So without your shoe on, you want to really massage that out. And that will help to kind of jumpstart the circulation and the healing process of those ligaments. So now moving forward, let's suppose most of the swelling is gone, the bruising is gone, and you can walk fairly normally without limping and without too much pain. Now we want to advance to some more more closed chain strengthening. So closed chain means that your foot is planted on the floor. So a good basic one that you want to be able to do is stand and balance on one foot. Now if that's easy, there's some things you can do to make it more challenging. You can dribble a basketball, or you can toss a medicine ball back and forth with a workout partner, or you can also take a pillow or some type of foam, soft, squishy surface. It also works well to stand on your trampoline and put on the floor. And being on a unstable surface like this forces you to use those muscles a lot more to balance yourself. So this is a great way to rehab a sprained ankle. And again, if this gets easy, you can make it more challenging by closing your eyes, by tossing a ball back and forth, those types of things that challenge your balance. Then the last two exercises I'd like to show you are calf raises and toe raises. So what you need for those is a stair. And so I'm just gonna use this step here. So for the calf raises, you're just gonna put your toes on the edge of the step. Make sure you got a good railing to hang on to. And you're just gonna go down and really stretch those calves, and then you go all the way up. And go nice and slow. So kind of pause for a minute at the bottom and stretch those calves and go up. And when that starts to get easy for you, you want to get strong enough where you can do that on just one foot. So on the side that you sprained, you want to get to the point where you can do that, 20 or 30 times and build up that strength till you can do that. And then the last one is the exact opposite, where instead of having your toes on the step, you can have your heels. And again, do this on your steps with a railing. But you drop your toes down, and then you pull your toes way up high. And same thing, you could advance this to doing it with just one leg if you want to. This works the muscles in the front of your shin bone, your dorsiflexors, and that will help you to regain strength. And again, these are more advanced exercises a few weeks after the sprain. So they recently did a medical study. People who do rehab, do physical therapy after an ankle sprain, they recover more quickly and more completely. They're able to avoid lingering effects of an ankle sprain. So I hope this was helpful. If you have any questions or need some ideas on how to rehab an ankle sprain, please feel free to call into us, and thanks for watching.